Paranoid personality disorder, PPD, is a mental health condition characterized by pervasive distrust and suspicion of others, even without sufficient evidence to justify these beliefs. People with PPD often interpret others' actions as malicious, deceitful, or harmful, which can lead to difficulties in maintaining relationships and functioning in everyday life. This pattern of thinking and behavior is long-standing and consistent, shaping how individuals with PPD view the world and interact with those around them. The symptoms of PPD can manifest in various ways, all rooted in a deep-seated mistrust of others. Individuals with the condition may assume that people are constantly trying to deceive, exploit, or harm them. They might read hidden meanings into harmless remarks or events, misinterpreting them as threats or insults. This can lead to a reluctance to confide in others, even close friends or family, out of fear that the information will be used against them. People with PPD are often hypersensitive to perceived criticism, becoming defensive or argumentative over minor issues. They may also hold grudges for long periods, struggling to forgive perceived slights or wrongdoings. The causes of PPD are not entirely understood, but like many mental health conditions, it likely arises from a combination of genetic, environmental, and psychological factors. A family history of personality disorders, particularly those involving paranoia or similar traits, may increase the risk. Early childhood experiences such as trauma, abuse, neglect, or growing up in an environment where trust was repeatedly broken can also contribute to the development of PPD. Some researchers believe that certain personality traits, such as a tendency towards suspicion or fearfulness, may interact with life experiences to form the patterns seen in PPD. PPD can have a significant impact on both the individual and those around them. For the person with the disorder, the constant state of vigilance and mistrust can be exhausting, leading to feelings of isolation and loneliness. It can be challenging to build or maintain close relationships when suspicion overshadows trust. In work or social settings, misunderstandings and conflicts may arise, as the individual may misinterpret colleagues' or peers' intentions. The stress of living with PPD can also take a toll on physical health, as prolonged anxiety and hypervigilance can contribute to issues like high blood pressure or sleep disturbances. Family members and friends may feel frustrated or helpless, unsure of how to navigate the relationship without triggering defensive responses. Treatment for PPD often requires patience and a tailored approach, as the mistrust central to the disorder can make individuals hesitant to seek or engage in therapy. Psychotherapy, particularly cognitive behavioral therapy (CBT), can help individuals recognize and challenge distorted thought patterns, improving their ability to interpret situations more accurately. Therapy may also focus on building communication and coping skills, fostering better relationships, and reducing feelings of isolation. Establishing a strong therapeutic alliance is critical, as trust between the individual and the therapist forms the foundation for meaningful progress. Medications are not typically used to treat PPD directly, but may be prescribed if co-occurring conditions, such as anxiety or depression, are present. Recovery from PPD is a gradual process that involves developing insight into the patterns of mistrust and learning to replace them with healthier ways of thinking and relating to others. While the deeply ingrained nature of PPD means that complete recovery may not always be achievable, significant improvements in quality of life and relationships are possible with consistent effort and support. Building a routine that includes stress management, self-care, and engaging in supportive social environments can make a significant difference. With time, understanding, and the right resources, individuals with PPD can find ways to navigate the challenges of their condition and foster more fulfilling connections with those around them.